I'm Mark Lindgren. I'm the chair of Healthcare for All Oregon. I've been chair since about 1999 or so. I was the volunteer chair during the Measure 23 campaign that would have instituted a healthcare system for the state of Oregon. Since then, we've been working on advocacy and education efforts, and we've been working with stakeholder groups to put together another initiative that would be similar to Measure 23 in the character. And right now we're working on seeing if we can put something on the ballot for 2008. Well, Measure 23 was basically progressively financed. It would have provided a comprehensive set of benefits to all residents in the state of Oregon. It would have been privately delivered. It was publicly accountable. And I think overall we're very proud of the way it was written. Our primary objective is to change the way that the medical system is financed. The current healthcare system often provides perverse incentives to how services are provided, so relatively few of our healthcare dollars go into providing services, and there's different estimates for how much of that is wasted. If you count both the administrative wastage involved in how insurance companies provide the services, as well as the wastage involved in the sheer amount of paperwork and administration in individual providers, physicians' offices, that's often estimated at about 40%. Another way to go in the future would be to simply set up a number of independent networks that would basically bid on providing healthcare services, say, to 250,000 people in different geographic areas of the state. I think there would be relatively little administrative wastage with that, and from a political standpoint, that would allow you to break some of the political logjam that currently exists with insurance companies providing a significant amount of resistance to change in the current system. Most of the industrialized countries of the world have fairly good health care. The World Health Organization rated the United States as number 36. There's a real clear divide about the quality of services you get if you're very well-to-do or whether you're poor and don't have access to comprehensive health insurance. Those distinctions are starting to break down now because even people of, middle class are starting to suffer the breakdown in the healthcare crisis. There is people in California who are suing health insurance companies because their coverage was retroactively terminated when they became ill and actually needed to use those services. Many people perceive the problem as being an issue of access, and we think that misses the mark entirely. A lot of people have health insurance, but it's basically simply for catastrophic coverage. I think 2/3 or 3/4 of the people who are undergoing personal bankruptcy had health insurance before they became ill or suffered some sort of debilitating illness that required medical treatment, and subsequently the cost of which drove them into bankruptcy. So access is not really the issue in this crisis. I think in Oregon we've certainly been focusing on private delivery of services, and my understanding is that is what they do in Canada as well. They do a lot with the money they have. They provide better health outcomes for about half the amount of money going into it. At the same time, I think we've heard some grumbling about the waiting times for services, which I think generally reflect the fact that the funding for the system comes out of the general fund. And over the last 20 or so years, that general fund in Canada has had problems of being underfunded. We responded to that with Measure 23, as we will in future legislation, by proposing that funding for any healthcare system not come out of the general fund, but indeed come out of a dedicated fund.